Outcome is one of the cornerstone in the value-based healthcare era. In fact, measuring outcomes, it tells us more about the value we provide to patients. And in fact, adding patient perspective to this outcome making sense, because we are saying that we are measuring what matters to patients. So when we ask patients about some outcomes such as pain, functional limitation, we are embedding the outcome or the perception of patients rather than leaving the system assuming that. And in fact also, measuring outcome is the only way to understand if the treatment we provide resulted in true improvement. Outcomes defined from different angles. And when we talk about PROMs as an outcome defined from the perspective of patients, we would love to see these outcomes integrated into the healthcare system, integrated into the care pathway, analyzed instantly, and utilized as well in physicians' offices and consultation offices. Now, currently, we are pushing people to start using the PROMs, but in future, I'd love to see patients themselves participate in designing future PROMs. From my perspective, the biggest challenge we are experiencing nowadays is the misalignment we are seeing between provider, payer, and regulator. This misalignment could be one of the true reasons behind the slowness of the progress of value-based healthcare, because we understand that different incentives and each of these parts is looking at the incentives from their perspective. But when we redesign the system to have a kind of a mutual platform where all these parties together shape the new model of reimbursement and incentives, I'm sure this will dramatically speed up the implementation process of value-based healthcare. Indeed, we have selected and implemented iCHOM sets for low back pain and diabetes and some other conditions. Our selection wasn't haphazard. We have selected these conditions basically because it's aligned with our strategic priority, as well as we do have a high volume and high need in these conditions. In addition to, we believe that these conditions require multidisciplinary in order to have superior outcome. So, and this could explain why we have successful implementation. Now, implementing these in some of our hospitals tend to have a better outcome. And when I say better outcome, I'm talking about better CROMs as well as better PROMs. Patients, they start to feel the value behind the implementation of these sets. What's strong about these sets actually, it gives you a structured way of implementing value-based healthcare, and we like to call it the iCHOM way, because basically these sets gives you not only the case mix variables, it gives you the case mix, it gives you the PROMs, it gives you the CROMs, and it tells you how frequent even you should measure all these measures. That's why such a structure method valuable and easy to use. In fact, iCHOM plays an important role in having the ground and the structure to speed up the implementation of value-based healthcare, providing different resources such as iCHOM conference, such as iCHOM accreditation, in addition to the wonderful iCHOM datasets on their official website. Having and utilizing these outcomes will definitely push the implementation much faster than what we're experiencing nowadays. Now, we would love to see iCHOM connecting the reasons for slowness. As I said, the misalignment between provider, payer, and regulator could be one of the attributed factor regarding the slowness we are seeing in the implementation of value-based healthcare. We would love to have ICHOM taking part of that, killing this misalignment in order to have probably a proposed distribution for incentives or suggested reimbursement model. This will help us big time. What's nice about ICHOM conference for this year, 2025, is moving from concepts to reality. It's moving from what to how. This could explain also why we have seen during this conference this year multiple initiatives and multiple success stories based on the implementation during the last few years. Actually, having this gathering and networking in such a great conference, it gives you also some new ideas probably didn't cross your mind before. This is something good when you see it succeeded where else, and then it gives you idea that there is a value behind the implementation of value-based healthcare. So thank you, ICHOM, for arranging such a great conference.